This is Stanford Engineering's The Future of Everything, and I'm your host, Russ Altman. Today, Professor Anisha Patel tells us how engaging a local community about their health concerns can lead to impactful discoveries and interventions. She'll tell us how a visit to a middle school helped her team realize that the simple access to water, drinking water, was a problem in schools across the nation, and how similar interactions during COVID created a system of free lunches that helped ensure the security of food for children across the country. It's the future of community health. We all know that physicians care about the health of their individual patients, but increasingly it has become clear that the health of individuals is tightly linked to the health of their community. And so population health experts need to engage with communities to find out where there are opportunities to improve everyone's health. A key component of a community is the schools. Children come to school every day and spend lots of hours there. They eat food, they drink beverages, and they play in the playground. The habits they form in school can profoundly impact their health, both in the short term and in the long term. Things like obesity, diabetes. Simple things like access to water, access to healthy lunches, and good amounts of exercise can therefore be evaluated by experts in the school system to figure out if there's opportunities for improvement. Anisha Patel is a professor of pediatrics and population health at Stanford University. She works with communities to identify the most pressing health issues, especially those related to childhood obesity and secure access to quality food and beverages. Once she identifies potential solutions, she works with the same communities to roll them out in ways that are accepted and adopted. Anisha, your research has had a focus on access and use of something as simple as water for the health of children. Why is this such a critical issue? It's somewhat shocking when you first think about it to know that this is still not a solved problem.
Yeah, so I totally agree with you. It seems like in a place, especially, as, developed as the United States, that this wouldn't be a problem that we're having to deal with now in this time and age. But we all know that children and adults, for that matter, really require water for all of your bodily functions. It really helps to, I started on this topic area focused on childhood obesity prevention, but it's also important for preventing dental caries, particularly given that the water in these communities, typically tap water, is fluoridated. Also, if children are consuming water as a substitute for sugary beverages, such as sodas or sports drinks, it can also help to prevent weight gain, diabetes, all the other subsequent health consequences that we're seeing, especially today with the pandemic, with those increasing rates. In addition, I think it's also important for attention and learning in schools. We've all had those days where we've forgotten to drink. We come home with a big headache. So you can imagine children, if they're not drinking all day in school settings or even in their childcare environments or home, they would have problems concentrating and learning as well. So for all those reasons, I think it's critical that we have ample supply to drinking water and safe drinking water too.
Yeah, so this is great, and as I reviewed some of your papers that you've written, it became clear that this is a huge issue. And so, can you give us the dimensions? So everybody thinks, well, come on, it's water. You turn on the tap and you drink it, but that's not the case for many children, both in terms of their habits, but also their access. So, how big of a challenge in developed world like the United States is this? Can you give us a sense and give me some stories about what we might be surprised to learn about the access to good quality water?
Yeah, so I think, I can tell you the history of how I started working on this because I think it's really interesting. So I was a pediatric resident here at Stanford many, many years ago. And at that time, I knew I was interested in really addressing public health at a population level, in addition to my clinical work that I was doing in the clinic, serving patients in a general pediatric setting. And went down to UCLA to start up a fellowship there and started working on a project that really used community engaged research approach, where we were partnering with community organizations to address a topic that they understood as being really in need of intervention at that time, which was childhood obesity. And so part of that process was going to the schools, just checking out what was going on, talking to students, talking to parents, talking to teachers to understand, what would be the key ingredients for this intervention. And I still remember I was out in Los Angeles. It was a really hot day out in the schools, and these were low-income schools and low-income areas of Los Angeles. And we were observing the school cafeteria and the lunch line. And students came up to us and they said, you know what? What we really need is we need water. And I said, what? You need water? Tell me more about what you're talking about. And
Now,
they
now
said,
how old were these kids?
these were middle schoolers.
Middle school. So sixth, seventh, eighth grade, like that.
Right. So they were very vocal. You know, they wanted us to know what we should be working on for them. And, you know, I looked and we saw this drinking fountain. It was sitting outside. It was a porcelain drinking fountain that's very common in most of our California schools outside of the cafeteria. And it looked really gross, right? It had some leaves in it. I don't even think it was fully functional. And then we saw juxtaposed with that was a vending machine in the schools. And California had just passed legislation that would require schools to not offer sugary beverages. And this would be staged over time. So at that time, they still did allow sports drinks and juices, flavored milks in the vending machine, but there was also bottled water. So these students who were coming from very low income backgrounds, really their two options were to drink from this fountain that probably none of us would want to drink out of, or to get water from this vending machine. And many of them don't have the $1.25 to purchase that. In addition, like in the cafeteria, they just don't have time to really go outside and go visit. Sometimes they're not even allowed to leave the cafeteria.
Right. And there can be social consequences to leaving a table when you're in seventh grade.
Right. So all of that, I think, just made it very clear that this was an issue that we were facing. And because we were using this community partnered approach on this research project, we had a community advisory board set up, and it had school officials, parents, students, also the public health department, LAUSD, and also advocacy groups. And there was an advocate organization called California Food Policy Advocates. They're now called Nourish California. And they were at the table, and I was presenting the story about what we saw in the schools, and they said, this is not right. Like, these students should have access to drinking water. It's a human right. It's a basic necessity. So they went and they talked with Mark Leno, who at the time he was a senator out of San Francisco. And he heard this story and he said, you know what, I'm going to start to introduce some legislation that will make this right in California. And before you know it, we have this policy passed that now requires drinking water in cafeteria settings. And that then led to legislation at the federal level in the 2010 Healthy Hunger Free Kids Act, President Trump signed. So just to give you a sense of like how a little story from a local school district, when heard by the right person, can actually impact policy change.
I love that it was middle schoolers because in my experience, having had 3 of them, they are among the most frank people in the world.
They sure are.
And they live. And when I was reading about that, I just have to ask another. So I know that your work has extended past middle school into both high schools and K through middle school. Related to all of this is access to bathrooms. Now, many of us who went to high school remember that there was huge incentives never to walk in to a high school restroom because of the folks who were there and what they were doing. I won't go into details. I think most people. So is this, and I just have to ask, is this part of it as well? Because I know that, especially with all my old man friends, drinking water has some very predictable consequences in terms of using restrooms. Maybe I'm asking a ridiculous question, but does that factor into this?
It definitely does. In fact, you would be surprised how many different aspects come into play when you start to implement an intervention in a school to increase access to drinking water. So this has come up from students, especially in the middle. I think in elementary schools, it's less of an issue, but in middle, high school, the concern about going into a bathroom, to have to use it. Sometimes, there can be consequences in terms of bullying or just not wanting to use the bathroom at school. So we do make a concerted effort to understand like what the school policies are related to restroom use. Are students allowed to go use the bathroom during the day? And that was something we had to talk about when we implement the intervention with the teachers to make sure that students have access and can go use the restroom if we're promoting water. I would say after working with so many schools across the Bay Area, it really hasn't been as much of an issue as we thought it might have been.
I was in New York in the 70s and it was very, very bad. So now you've really established, and you mentioned that your initial concern had been obesity. And we've all heard about sugary beverages, and as a pediatrician, I just want to confirm this is a huge issue for child health. In other words, even that one kind of isolated issue of whether they're drinking water without sugar versus these either colas or even fruit juices like apple juice, is the data very clear that this is contributing in a significant way to obesity and other health problems?
Yes, there have been numerous studies spanning from, cross-sectional studies where you take a cross-section of the population and look to see if those who drink sugary beverages have, health consequences. Also longitudinal, where we follow them over time to see, like, if you drank sugary beverages at a certain age, were you more likely to drink it in the future and have those health consequences. And also randomized controlled trials where there have been efforts to replace sugary beverages in a school setting or a home environment, give families access to water or non-caloric beverages, even diet beverages. And even those studies have shown an association with prevention of obesity. So I think the evidence is very clear now that this is a contributor, not only to obesity, but also cavities and some of the other, consequences as well. So I think we have sufficient evidence at this time to say that this is an issue that we should be addressing.
You just mentioned diet beverages, and I wanted to ask, because I'm sure parents everywhere are wondering about this. As a pediatrician and a population health person, what is the deal with diet beverages and kids? You could imagine it as a gateway beverage to sugary. So how should parents think about that?
Yeah, so non-nutritive sweeteners, or these, caloric sweeteners that are used without calories to sweeten these diet beverages, there really haven't been long-term studies because, they're relatively new if you think about when you remember seeing diet products on the market. And so I think in terms of a substitute, it's really important to think about what is the data out there. And if you actually look at the FDA classification of some of these non-nutritive sweeteners, especially things like stevia that we've seen that are more natural, they are they have this designation called generally regarded as safe by the FDA, which means like they don't think that there are any consequences, but there haven't been cumulative evidence to definitely say that there is no issue. There is some data suggesting that these sweeteners are also many, many more times sweeter than just sugar. And so that could then lead to preference for sweet for young children, especially when they're really developing their dietary preferences at an early age. The other thing that's come up in terms of emerging evidence is effects on the gut microbiota or the microbiome. And so for all those reasons, the pediatric, actually, there was a group of experts that came together to put together some healthy beverage recommendations for children. And it's a great website called Healthy Drinks, Healthy Kids that parents or practitioners can go to. But in there, they do highlight that we really don't recommend non-nutritive sweeteners, especially in the younger age groups. And then I think from an obesity management and treatment standpoint, though, I do think maybe there may be a role, like if you have a patient that really has diabetes and really needs a substitute and able to switch over from, drinking a lot of sodas per day and go to something in between. But a lot of times we recommend, maybe flavoring sparkling water with a little bit of juice as a kind of secondary kind of drink before you get totally to water.
I know that you've gone beyond water, and one of the things you've looked at are meals at schools, and that clearly has a connection to the obesity epidemic. What is the kind of work you've looked at meals? And tell me about the photo evidence that you have worked on, which sounds very fascinating.
Yeah, so this actually is a wonderful project. This is probably the most excitement I've had for a study in a while. But when the pandemic started, we had a randomized control trial that had just begun in elementary schools here in the San Francisco Bay Area, where we were installing reusable water bottle filling stations, providing students with reusable water bottles, and also had a whole curriculum to get students excited about drinking water. And so the pandemic started, the schools closed. We were like, okay, let's go back into the school. We'll be back, because at first they said, it'll be closed for like a couple months. And we're like, okay, after spring break, we'll go back in. It'll be fun. And then, a year later, schools are still closed. So we were like, okay, we're not working on this in the same way that we were. But then these organizations out in the San Joaquin Valley region of California, they reached out to us. Cultiva la Salud and Dolores Huerta Foundation. They reached out to Ken Hecht, who actually was the initial person I was mentioning who heard the story about the water access. He's a lawyer. and he was the director of the California Food Policy Advocates, and we've been working together since that time. But these groups reached out to Ken and said, we are so worried because the schools have closed, and for our families in this region, which are primarily, it's an agricultural region of California, right, with low-income populations, primarily Latino. They said, we have high rates of food insecurity here. How are these children going to get their meals? They really need these meals in order to impact their food insecurity studies. And so we started calling around here in the Bay Area, asking some schools. We actually reached out to Ravenswood School District in East Palo Alto and said, what are you guys doing? Because we heard that they were actually able to offer the meals to students, even though the schools were closed. So we gathered some stories. We also talked to USDA and heard that they were going to allow some flexibilities for the meal program. So the United States Department of Agriculture was going to roll out some new flexibilities that would allow schools to provide meals to students during the pandemic. So basically what happened was schools could actually have these grab and go meals. So parents could come to the schools, pick up the meals, take them home and eat them and have them for Zoom. Or some school districts actually delivered them to like bus stops in the neighborhoods. Because a lot of families, it's hard to leave your Zooming little ones.
Yeah, it was just
meal,
yes.
Right? So there was a number of issues that came up, but we started working on this topic, and one thing has led to another. We first explored Ashley Joel, who's a medical student here at Stanford. She worked with our partners to conduct a study where we interviewed 360-degree interviews with school district officials, food service directors, community-based organizations, parents, to understand what were the barriers and facilitators of getting meals to students during this time. We found some really great lessons learned there that could be applicable for summer months when we face the same issue where students don't have access to meals. We then heard from the parents, actually. They were really worried about the meals because this was the first time a lot of these parents had even seen the school lunch, right? Like you send your kid to school, you don't know really what they're eating. But now
it's like a don't ask, don't tell situation.
Yeah. Now the meals are coming to the house, right? So these parents were seeing these meals, and actually during the pandemic, one of the USDA flexibilities was you didn't have to be as strict with regard to the dietary requirements, because the meals actually have very strict requirements with regard to salt content, fiber, fat. The only thing that isn't regulated currently is added sugar. But these meals didn't have to go through those same requirements during the pandemic because it was just so crazy getting food to anyone, because supply chain and everything. So the meals were coming in. Parents were really concerned. They were like, here we are in the San Joaquin Valley where we are working in these fields and farms to produce food for the whole country. And we don't even get access to those fruits and vegetables that are grown right here, right? They were they were like, this is not just. And so we have been using those photo evidence. What they did was they took photographs of the meals that were coming into their homes for a whole week.
Wow.
They worked with our community partners. They uploaded them into a Google spreadsheet with all their little identifiers on a postcard. They also then participated in focus groups to tell us a lot about why they took those photographs, what they were seeing, what they were worried about, what was good too. We wanted to hear the good things too.
Right, it's like Yelp for food, Yelp pictures of food, but for the school food programs.
Yeah, so that also we made them into PowerPoint presentations so that the parents could actually provide these presentations to the school districts to let them know what they were seeing, what they were concerned about. So now we're working on a project because we also heard from the parents. They didn't know that school meals met specific nutritional dietary requirements. So we're working with Suchi Huang, who's a professor of marketing in the School of Business at Stanford, and she's helped us work with parents using a co-design approach where we're working with families to actually develop marketing materials. And we've rolled out these marketing materials in schools to try to increase participation and also help parents understand, the value of the meals in terms of, because we do know these meals are actually beneficial. Students who participate in the meal programs, they're more likely to have better learning outcomes. They're also more likely to have improved dietary quality and also better weight status measures. So we know these meals are very important in terms of health and learning.
This is The Future of Everything with Russ Altman. More with Anisha Patel next. Welcome back to The Future of Everything. I'm Russ Altman, and I'm speaking with Professor Anisha Patel of Stanford University. In the last segment, Anisha described how access to high-quality water is an important health issue for children, impacting their risk for obesity, diabetes, dental cavities, and how secure access to quality school lunches is critical for so many children, especially during the COVID epidemic, but even in an ongoing way. In this segment, Anisha will describe why her approach of engaging the community works so well, and how she works with business marketing experts to try to disseminate new health practices and innovations to these communities so that they can understand and adopt them. All of these stories that you're telling us are remarkable to me because you went out to the communities and you engaged them. And it wasn't a purely academic ivory tower exercise, but a lot of the problems and the questions came from the community. Is this a trend? Should I be surprised that this is how research is happening, or is this exactly how it should happen?
Well, I'm biased. I think this is exactly how it should happen, but I will say this approach, it's called community engaged research broadly. There's a spectrum there. And at the far end of like the gold standard would be community-based participatory research, where you actually work with community members, institutional organizations, even governmental organizations, policy members, advocates, pretty much anyone that you're trying to capture the perspectives of in order to address important problems. And with participatory research, the goal is actually to go to the community, understand what their problem is that they want you to address, and then work with them throughout the research process. So to actually design the interventions or the study, implement the study, and then also evaluation. And lastly, I think most importantly with community groups is the dissemination piece, because they have all the connections with the individuals that need to really get this information to make changes on the ground in terms of practices and policies. We know, for example, historically that by the time the evidence is generated, it usually takes about 17 years for it to actually get translated to have impact. And so by using this approach, I'm hopeful that we're able to very much shorten that process.
Yeah, so you've written a little, in terms of that translation, you've written a little bit about free lunches and the challenges of where there could be a program, it could be funded, it exists, but people don't use it. Can you tell us about that?
Sure. So actually, luckily here in California, thanks to these waivers that happened during the pandemic, meals were freely available to all children, regardless of their income status. They could go to any school near them where they lived and pick up a hot meal. And we realized here in California that this was so critical and so important for addressing food insecurity that now we have a new program in California. California is the first state, but there's other states that are following suit across the country where we have universal free meals. So regardless of whether you live, in a really wealthy community where you have a lot of disposable income versus
let's just say Beverly Hills.
Yeah, Beverly Hills. You can go to your school and get a hot lunch for free. You don't have to pay anymore. And a lot of parents don't even know this yet. So I think it's great that California is getting out the information. But as I mentioned, because families saw these meals during the pandemic, they may be worried about the quality of the meals and have concerns. And so, we've been working to market these meals to families to really use because as public health practitioners, I think we have no background in marketing at all. And so this partnership I have with this professor in the School of Business has been critical to really kind of meld those two disciplines together. She's really helped us think in innovative ways about how we might market the meals, how we might pilot test messages. So one of the messages that the parents liked the most, surprisingly, was about how the meals were supporting local farmers in their community in the San Joaquin Valley. That was the top message. And so we'll see how it works out. We've tested 4 different messages. We'll see which one's working the best. But we do know from food service directors in California, that is something they need. They need help with marketing their meals to students and families.
So it's fascinating because we started out talking about community engagement where they kind of help define what the problems are. Then we try to find solutions. And then there's this second engagement trying to convince the community that this is a responsive solution that meets their needs. And it sounds like it's a work in progress, but it's fascinating to know that the business world has lessons for the health world about how to kind of change behavior in a good way. And that's fascinating. What other ways are you exploring to translate your findings into accessible decision making by the community in terms of changing behavior or adopting new practices?
Yes, so one example is a policy brief. So we a lot of times will work with an advocacy organization or policymakers to take our evidence and then distill it down into a one-page kind of handout that we then can pass off to policymakers or to advocacy groups so they can actually circulate the information around. So that has been very helpful. But I think the other thing is just getting the meetings with those policy advocates to have a conversation with them about our research findings. We also have developed a number of toolkits. So from our water in schools work, we have toolkits that really show schools step by step how, if they want to install drinking water bottle filling stations in their schools or test drinking water for lead or even promote water, develop some promotion campaign, how they might be able to do that. I also was able to work with a collaborator on a cookbook where we really talked about why added sugar can be detrimental to health outcomes and what are some creative ways to think about providing healthy options for children in terms of recipes.
Yeah, tell me more about the cookbook. So is this geared towards children or toward their parents or all of the above?
Yeah, it's geared towards children and families, I would say, but others can use it as well. We've taken kind of family favorites and tried to incorporate some culturally appropriate recipes too from just being in the US that have a lot of added sugar. So we know like added sugar, you know when you're consuming added sugar, maybe in a sugary beverage or perhaps when you're eating a piece of cake. But you may not know that salad dressing, when you're trying to be healthy and eat a salad, that salad dressing has a lot of added sugar in it. And so we've taken recipes for items that we know are heavily loaded with sugar and reduced them by at least half.
Is salt intake important for the pediatric and for these populations? As I know that for the elderly, it becomes an issue as well. But what's your deal on salt?
Salt is also very important to think about, especially for children, but also the older adults that are living with the children. So actually in this cookbook, we made sure that we were also in line with the salt as well recommendations, because once you take away sugar, a lot of times you'll want to add salt or something else to make it taste exactly the same. And so we wanted to make sure we definitely didn't do that.
I'm not surprised to hear that. My wife and I have been watching cooking YouTubes, and the amount of salt that is recommended for so many recipes, and you people literally are scooping up handfuls of salt and throwing it into the bowl, and it's quite amazing. Of course, I'm sure it leads to tasty food, but I'm also sure that there are health consequences. Thanks to Anisha Patel. That was the future of community health. You have been listening to The Future of Everything with Russ Altman.